Welcome to my podcast. I'm going to talk about another common case that you could face in the general practice or in any clinic. And basically, as we always agreed, that you need to greet the patient, introduce yourself, and check the patient name, date of birth. Then you'll ask the patient, how can I help you? The patient might say, oh, doctor, I'm having this general itching in my skin. Doesn't go away. It's just embarrassing. I can't settle in anything I'm doing. I feel embarrassed from the social gathering, and I can't sleep from the itching. So this basically could happen anywhere in the body. It could happen in the legs, it could happen in the body, it could happen in the private area, it could happen in the nuts, it could happen in the back of the neck, the nape. So basically, you will ask the patient, can you tell me more about it? So the patient might say that I'm having this for the last maybe 1 year or so, and you'll ask the patient, do you have any idea or thoughts what might be the reason for that? Do you have anything that you feel might trigger your scratching cycle? Did you start to think about how you can break this cycle, maybe by distracting yourself, by avoiding to scratch it? So there's a story about a man who was a worker, and he seemed to all the time scratching on his walls, and obviously this caused him a lot of anxiousness and embarrassment. So he attended to his GP, and he wasn't sure what's going on, because basically the skin is clear and there isn't anything to see. So in that situation, you will ask the patient if there is any past medical history, or if there is any medication that the patient take in the long run, or if there is any known allergy that could contribute to that, if there is any family history. So the patient might say, oh, doctor, I'm having certain condition whereby I'm taking OTC medicine, or maybe due to his anxiety and his worrying all the time. So he's scratching, sometimes without his notice or his attention, or it could be like obsession compulsive disorder as well, whereby you feel that all the time you need to check on things or clean them all the time. So all of that things that you just need to bring to your attention, and just assess the patient according to the situation, and try to take any patient that could say, which could help in figuring out the issue. In those kind of patients, sometimes the GP or the doctor will just start medication blindly without looking into the case. I remember back home we used to see those kind of cases. So the patient might be started on antifungal or emollient without digging deep inside to the issue that the patient might have. Or maybe some cases they will start them in steroid, and bang, the patient will say, oh, I'm really feeling better, and my condition's settled, and I'm much better than used to be before. So always try to think about the differential whenever you face this sort of cases. The first thing that you could think of, as simple as that, is basically ixoriosis, which is basically skin dryness. So in that condition, if you haven't seen anything that could bring any alert or an alarm to a skin condition, you just give them emollient, basically as a soap and cream, according to the skin situation. So if it's not like unified, it's not thick, so you're gonna give cream. If it's thick and there is liquefaction and scratch mark, you will give ointment. The other condition you could think of as well, if there is any, for instance, if it's in the private area as well, you'll think about infestation. So, for instance, lice. So you need to ask about the hygienic status of the patient and give some advice about changing the underwear, wearing cotton underwear, change periodically, and shaving and cleaning, and using anything without any perfumed product in order to avoid any sensitization. Also, skin-wise, patient always give the general advice to use cotton, anything that's close to the skin, preferably to be cotton, light. Avoid any synthetic in order not to irritate the skin and go into the vicious cycle of itchiness. And the other definition you could think of, also a condition called Lichen simplex chronicus, whereby the skin is completely clear, but the patient keeps scratching, and that scratching will cause the skin to be thickened with time, and that's why it's called chronicus. Usually it's a simple condition which can be secondary to certain underlying dermatological condition or neuropathological condition that could lead to extreme anxious pruritus, which can be sometimes very very annoying to the patient, and the patient might feel that they're gonna go nut due to that. So it's been seen in certain cases, and it can be like something that can be faced in certain situation, because basically it can be exhaustive to the patient, and if it's not treated, it can be annoying. Another condition you could think of is nodularis or prurigo nodularis. Can be also causing multiple hyperkeratotic nodules and blisters, and can be extended can be seen anywhere in the body, especially in the lower limb. So in that condition, you need just to address the patient condition and treat it. And if there is any suspicion of any allergy, you could send for certain blood investigation just to rule out that. If there is nothing can be seen and the patient could not improve or not feeling any better, and there's some nodules, you could send for a biopsy or mycological study. If it's, all of that ruled out, you just consider breaking the itch scratch cycle and treating the underlying condition. And topical steroid is the first line treatment in those kind of condition in order to break the itch scratch cycle. You could start with the potent steroid and then reduce it gradually to avoid any adverse effect or rebound, and to restore also the barrier function of the skin. You can give moisturizer or emollient and try to avoid any triggering effect, as I say, like polyester, synthetic clothing, which can cause harshness, dryness to the skin, the tight-fitting clothing as well to be avoided. So in that condition, I hope that I covered the main issue around chronic itching in certain situation, whereby it can be really annoying and can affect the quality of life, quality of sleep of the patient, especially with the social gathering. Thank you.